Good morning to all. Myself, Andal, Mental Health Nursing Department. I am a professor in Faculty of Nursing, Rama University. Today, we are discussing about the schizophrenic. It is a very big mental health disorder and it is a very serious mental health disorder in the world. In the word schizophrenia, the word schizophrenia is started in the name of 1908, the name coined in the year of 1908 by the Swiss psychiatrist. The name of psychiatrist is Eugen Bleuler. This Eugen Bleuler only coined the name of schizophrenia. He given the name by the two meaning. The schis means, in that schizophrenia, schis means split. Phrenia means it is mind, means schizophrenia means split of mind, but it is not a split of personality disorder. It is a split of mind because the schizophrenia is having association of syndromes, means so much signs and symptoms of the mind. That's why this name called as schizophrenia. Next we will see the definition of this schizophrenia. The schizophrenia definition is, schizophrenia is a functional psychotic disorder. It is a psychotic disorder and it is characterized by disturbances in the thinking, emotions, volitions and faculties in the presence of clear consciousness. It leads to social withdrawal. This definition is given by Strivani. Actually, schizophrenia is a functional, it is a psychotic disorder, functional psychotic disorder, and it is characterized, means it is having the features of disturbances in thinking. Already I told it is a split of mind. So, it is mainly disturbing the thinking and emotions, volitions and faculties, means it is disturbing the willpower of the persons. Willpower and also the physiological power and also the psychological power, and it is in the presence of clear consciousness, because you know very well the persons is in semi-conscious, means they have the disturbances in the thinking, emotions, memories, all the things, but here in schizophrenia the persons with clear conscious, they are having the disturbances in thinking, emotions, volitions and all, and this disturbances which leads to the persons to at last socially withdrawal. Okay, this is the definition of schizophrenia. Next we will move to the epidemiology. Epidemiology, in the schizophrenia, the men is having more signs and symptoms of the woman. The men is affected more than the woman. And one more thing, the onset of the men, it is comes in the 15 to 25 years of the age, means mid-range of 20. And for women, it is coming to the age of 25 to 35 years, means after the range of the 20. But in men, it is showing the severe clinical symptoms of the men, and in the woman, it is showing less clinical symptoms only. But then, so here we are seeing the men is more affected than the woman in schizophrenia. And next thing we will move to the etiology of schizophrenia. Actually, in the etiology, it is unknown. In the schizophrenia, there is no any findings of the etiological factors, means the correct etiological factors is unknown. Then next, but according to the some theories, it is given some etiological factors. In that, the first one is biological theories. In that biological theories, there is a two factors is there. One is biochemical factor and the another one is genetic factor. In that biochemical factor, it is because of dopamine, the increased dopamine level in the neurotransmitters, it is leads to the schizophrenic disorders. This is why it is came, means, see, you know very well the antipsychotic drug is mainly the action is, it is D2 receptors, means decreasing the dopamine level in the neurotransmitter. So, it is decreasing the symptoms. Because of that, this biological theory, biochemical factor, it came, the dopamine level is increased, means the schizophrenia will arise. So, this is biochemical factor. Then next is genetic factor. In the genetic factor, there is a twin study is there. In that twin study, they are given identical twins is having the 50%. Identical twin is having the 50% of the chances of getting the schizophrenia. If it is non-identical twins means it is 15% of chance to get the schizophrenia, means in that identical twins one child is having the schizophrenia means another child is having the chance of to getting the 50% of schizophrenia, and in non-identical twins the person is having the one child is having the schizophrenic means the another child is having the chance of getting 15% of the schizophrenia. This is the biological theory. Biochemical factor means mainly it is increase in the level of dopamine, and genetic factor, it is a twin study. In that twin study they are given 50% of chance to identical twins, 15% of chance to non-identical twins. Then another factor is environmental factor. Environmental factor nothing, it is mainly happening there that some theories is given the parent when they are in pregnant period, if they are getting any influenza or any infection, then it is reaching the schizophrenia is arises leads to the child. This is one. Then next is any abnormalities happen, any complication is happen in the labor time, then it is a chance of to getting the schizophrenia. Then next is social factors. Social factors, in that social factors mainly the low socio-economic persons is getting schizophrenia. This is the main one, the low socio-economic status area persons are getting schizophrenia. And one more thing, the stressful life event. The stressful life event also leading the persons to the schizophrenia. The most stressful person, they are getting the disturbances in thinking and disturbances in the social attitude. So mainly they are having the social factors. So the stressful life events and the socio-economic status also leads to the persons to schizophrenia. This is comes under social factors. So the etiology is first main is unknown, and the three different types of etiology is given in the by the theories, that is biological theory, environmental factors and social factors. In the biological theory there is a two factor, one is biochemical factor and another one is genetic factor. And next we will move to the psychopathology of schizophrenia, means how it is arising. I already informed you that there is a etiological factors, that is predisposing factors. This biological factors and environmental and social factors, if it is arises to the persons, then it leads to the improper balance of the chemicals. The persons is getting in neurotransmitters, they are getting the improper balance of chemicals, and it leads to the clinical features also. This is happening the neurological, this is leads to neurological abnormalities to the persons. Because of that neurological abnormalities, the persons leads to the schizophrenia. This is the main psychopathology, means psychopathology, how it is arises the schizophrenia to the persons. First it is predisposing factors, the persons who is affecting by the predisposing factors, means any biological factor or any environmental factor or any social factor, then it is leads to the improper balance of chemicals and it gives the clinical features to the persons. This is leads to the neurological abnormalities in the persons, then it leads to the schizophrenia. This is the main psychopathology of schizophrenia. In introduction itself I told schizophrenia is a syndrome. It is a syndrome, means it is associated with more signs and symptoms. Okay, so now we will move to the signs and symptoms of the schizophrenia. If schizophrenia signs and symptoms means mainly we need to consider the 4 A's of schizophrenia. This 4A symptom is given by Eugene Bleuler. This person, see, Eugene Bleuler is a person given the name of the schizophrenia. This person given the 4A symptoms of the schizophrenia. This 4, if the person is having schizophrenia means definitely they have this 4A symptoms. That is, the first one is affect. Affect, it is affect means the person don't have the emotions, the inappropriate emotions they will show in the environment. Then next is associative loosening. They are having the loosening of association, means they are having incoherence, means the word salad. They are not having the logical speech. And the person having the autistic thinking, autistic thinking means preoccupation with the environment. They are in the conscious, but they are not in the real world. They are in the preoccupation of the world. Then next is ambivalence. Ambivalence means it is a conflict. The person is having the conflict with the same person, same thing, that they are having the two type of different attitudes. That is ambivalence, that means conflict. Then next we will move to the main three categories of the signs and symptoms in schizophrenia. In that, one is positive symptoms, and second one is negative symptom, and third one is cognitive symptom. The positive symptoms, it is a main psychotic symptoms of the schizophrenia. It is a psychotic symptom, and we can assess easily these symptoms, means we can understand the symptoms easily. The patient is having this symptoms because it is not a natural process and it is not a normal process. This is a psychotic symptom, so it is comes under the positive symptom. Means what are all the types of positive symptoms we can see in the schizophrenia? One is delusion, and another one is hallucination, then disturbances in speech, then disturbances in behavior, and catatonic activities. These are all the things we can see in the positive signs and symptoms. Delusion, you know very well, delusion is the means the person not believe the persons. The hallucination, it is a false perception, means the person is having without external stimuli, they are having some false stimuli, means false perception. They are in this, mainly in schizophrenia we can see in the auditory hallucination and visual hallucination. And next is disturbances in the speech, they are having the speech difficulties. And next is disturbances in the behavior. See, in the behaviors they are having some disturbances, means they will in the summer time what they will do, they will wear the woolen clothes and they will roam around. So they won't think to sweating and all. Like that behavior we can see in this person, means bizarre behavior. It is an unusual behavior. Then next is catatonic attitudes, means we can see in some other means the persons will mute, they won't speak, otherwise they will be excited. They have the motor activity will be more excited. These are all the positive symptoms. Then next is negative symptoms. The negative symptoms of the schizophrenia is mainly it is a natural and normal behavior. It is a natural and normal behavior, but it is disturbed. So the patients is, we can easily understand, but treating is very difficult in negative symptoms. What are all the things we can see? What are all the signs and symptoms comes under the negative symptoms? First is avolition, then next is anhedonia, then apathy, then affect, then alogia and social withdrawal. Avolition means it is a lack of initiation. The person, they won't have any interest in doing, means they won't have motivation. They are having the lack of interest in anything. Then next is anhedonia. Anhedonia means it is lack of pressure. The persons, if anything is humanly nearby is happen also, they won't show the emotions in their face. That is anhedonia. They won't give the pleasure. They won't be happy. Then next is apathy. Apathy means they are not having any emotions. Then affect. In that affect mainly the flattening. They will show the inappropriate emotions. Means sometimes if the person is going to any death ceremony, means they will laugh in that area. That is like they means they can't able to show the appropriate emotions in the according to the situation. That is affect. Then next is alogia. Alogia means it is absence of speech. They won't speak. They will be in mute. Then next is social withdrawal. The social withdrawal, the patients, because of the delusion and hallucination, any signs and symptoms, they will think, they won't believe others, they won't go with talk and others. So automatically the patients goes to the isolate themselves. So the last thing, the social withdrawal symptoms we can see in the patients. These are all the negative symptoms: avolition, anhedonia, apathy, affect, alogia and social withdrawal. Then next we will move to the cognitive symptoms. Cognitive means mainly it is a thinking capacity of the persons, that the person is having affected by thinking level. They can't able to think. Mainly they don't able to remember anything. their memory will be affect. Then they can't able to attention, means they won't hear anybody is speaking also, they won't hear, and they can't able to listen, and they won't concentrate in the work, they won't concentrate in anything, because of that their personal activities will be coming less. Then learning ability also will be affect. These are all the cognitive symptoms in that affecting of thinking, memory, attention, concentration and learning levels will be affecting in the persons. These are all the symptoms. This mainly we need to understand the 4 A's of symptoms. It is given by Eugene Bleuler. These are all the 4 A's: affect, associative loosening, autism and ambivalence. Then 3 categories of the signs and symptoms. One is positive signs and symptom, and another one is negative signs and symptom, and next one is cognitive signs and symptom. This is the main 3 categories of the symptoms of the schizophrenia. See, next we will move to the phases of schizophrenia. Means what are all the phases they are facing, the patients what are all the phases they are facing. There are 3 main types of phases. One is prodromal phase, means in this phase the patient is having the symptoms of withdrawal. They will not mingle with any persons, mainly they will be isolate themselves, that is prodromal phase. Then second is active phase. In the active phase, the persons is having the severe symptoms, like I told, positive symptoms and negative symptoms. That are all the symptoms we can see in this phase. Active phase, we can see in the positive and negative symptoms in the persons. Then next, the person move to the residual phase. In the residual phase, mainly we can see the cognitive symptoms of the persons. The persons is having mainly all the cognitive symptoms, like they will affect by the memory, thinking and learning. All these things affect in the stage of residual phase. Then automatically in the residual, from the residual phase, the persons goes to the prodromal, means withdrawal. They all mostly withdrawal means. And one more thing, these are all the chronic phase. This is the starting phase. The prodromal state is the starting phase, and active phase is the acute phase. It is the acute phase, and next residual phase is the chronic phase. In this stage, the person, chronic means it is a long-term symptoms. We can see the long-term symptoms in the patients in this stage, and mainly they will move to the prodromal symptoms. This is the cycle of the phases the persons having in the schizophrenia. First is prodromal phase, second is active phase, then next is residual phase. Then we will move to the types of the schizophrenias. That there are mainly 5 types of the clinical types schizophrenia. One is paranoid schizophrenia, second is epiphrenic schizophrenia. This is other name is disorganized schizophrenia. Then next is catatonic schizophrenia. In the catatonic schizophrenia, there is a 2 type of catatonic is there. One is stupor and another one is excitement. And next, fourth one is residual schizophrenia. And next is, the last one is undifferentiated schizophrenia. Other than this, we are having the 2 types of schizophrenia is the other types. That is, one is simple schizophrenia and another one is post-schizophrenic depression. This is the other type of this is the main 5 clinical types in the schizophrenia: paranoid, epiphrenic, catatonic, residual, undifferentiated. Other than this, we have some 2 more types is that is, one is simple schizophrenia and another one is post-schizophrenic depression. Okay, these are all the types of schizophrenia. In the paranoid schizophrenia, the name itself we can understand, paranoid means it is a delusion. Most of the symptoms or delusional symptoms we can see in this patient. And next is epiphrenic schizophrenia. Epiphrenic schizophrenia, it is a disorganized one. And next is catatonic schizophrenia. It is a stupor and excitement. Stupor means the patient always in the negativism symptoms and they will be in the mutism. Their motor activities will be very less and bizarre movements we can see in this patient. The next is excitement. Excitement means it is a more motor activity we can see in this persons. They always having the echolalia, echopraxia, all these symptoms we can see in the catatonic schizophrenia. Then next is residual schizophrenia. It is like the patients who is having means past schizophrenic conditions. Now presently they are having only with negative symptoms, not any having psychotic symptoms like positive symptoms. They have only the past schizophrenic history with negative symptoms, that is residual schizophrenia. Then next is undifferentiated schizophrenia. The name itself we can understood, it is undifferentiated. This all these types where the patient is having the all the type of symptoms, we cannot able to detect this is this condition of the schizophrenia. So this name is undifferentiated schizophrenia. Then next is simple schizophrenia. In the simple schizophrenia, it is also like a residual, but here there is no any past history. The patient is having only negative symptoms. And next is post schizophrenic depression. The patient is having the past schizophrenic history with depression. That is, and mainly in this post schizophrenic depression, the person is having the risk of suicidal. Then at last we move to the treatment to the schizophrenic patients. There are some treatments. Mainly we are going with psychopharmacological treatments. In that psychopharmacological treatments, we are providing mainly antipsychotic drugs to the patients. The antipsychotic drugs, already I inform you, means it is decreasing the level of dopamine in the neurotransmitter. By decreasing the D2 receptors, the patient signs and symptoms is getting less. That is why we are using the psychopharmacological drugs like antipsychotic drugs. Then next main treatment is the ECT, electroconvulsive therapy. The electroconvulsive therapy is not for all the schizophrenic patients. Mainly the patient who can have the severe symptoms, and mainly the patient with catatonic disorder. That patient we are moving with the ECT, electroconvulsive therapy. Then next, psychological therapies. See, the mental health means psychiatric. The psychological therapy is the main thing we are using for to treat the patients. In that, schizophrenic patients mainly we are providing the group therapy and individual therapy, family therapy, then soft skill therapy. Then next mainly we need to provide the cognitive therapy because the persons are having the cognitive symptoms. So for relieving that, mainly we need to move with the cognitive therapy. These are all the main psychological therapies we are providing to the schizophrenic patients. Then at last, the last and most important one is rehabilitation. The rehabilitation is the person who is means their symptoms was reducing, who are coming to normal. For that person, we need to provide some occupational effects, means that we are providing some occupational therapy, means they need to go and socialize in the society. So the rehabilitation is the main and last and main one to the persons we are providing the treatment. These are all the 4 main treatments we are providing to the schizophrenic patient. So at last I am concluding my topic. Up to now we are seeing the introduction about the schizophrenia, and next we move to the definition, and next we saw the epidemiology of the schizophrenia. In epidemiology, the men is more affected men is more affected than the woman. Then in etiology, there is an unknown etiology. Then psychopathology. Then we move to the signs and symptoms. We saw the signs and symptoms of the patient, mainly the 4 A's symptoms and the 3 types main categories of the symptoms like positive, negative and cognitive symptoms. Then phases, 3 types of phases we saw: prodromal phase, active phase and residual phase. Then types of the schizophrenia, 5 main clinical types and also 2 other types we saw. Then next at last treatment we saw in the schizophrenia. I hope all you understand what is schizophrenia, and thank you to all.